Welcome everyone. VegMed 2023. We're back after 4 years of no in-person conference, and it's an absolute pleasure to be here with our conference partners, Physicians Association for Nutrition, and our main supporters, ProVeg International. We wish you a hugely inspirational, educational weekend, forming new contacts, new skills, and hopefully this is one of many more conferences to come. So this conference wouldn't have happened without our amazing sponsors, and please go and speak to them in the exhibition areas. Oatly and the Good Pea Company have provided the dairy alternatives for the day. Hammersmith Books will be selling a lot of our books today. Overcoming MS, Linwoods are also here supporting our work. And I do not know how to thank Mad Ideas enough. They have been behind the scenes on our website doing the IT. They have a stall. Please go and thank them in person, show them your love and respect. Our exhibitors are here, aligned with our work. We have Made in Hackney, Health for Extinction Rebellion, Greener Practice, Vegan Organic Network, and Simonix. So on to my talk for the introduction. I'll be joined on the stage shortly with Wendy Walrabenstein from Pan International. I'm going to be covering where we are at this moment in the field of plant-based nutrition, the work that we've been trying to do over the last 5 years at Plant-Based Health Professionals UK, and some ideas about how we might, after today, work together. I always start with this slide. Our food system is at the centre of virtually every single crisis you can think of. The climate and biodiversity crises. 2 days we'll be talking about the health crises. My father will be talking about the crisis in soil health. And of course, we are here because we care about animals and everyone else we share this planet with. We slaughter 80 billion land animals a year, 2 trillion fish, and we expect our fellow humans to work in slaughterhouses for food that we do not require. When it comes to health and diets, we're really in catastrophe. Unhealthy diets are now responsible for 1/4 of deaths globally and around 1/3 of premature deaths in Europe. At the same time, the food system is creating around 1/3 of all greenhouse gas emissions, not to mention the land and water pollution, the biodiversity loss and so forth. And the problem is only increasing, both malnutrition and obesity. The real problem throughout the globe is that we're eating too much in the way of ultra-processed foods. In high and middle income countries, we are consuming too much meat, and that's only increasing. And regardless of which country you are in, we are not consuming enough of the healthy plant foods, fruits, vegetables, whole grains, beans, nuts and seeds, those that really nourish our body. I highlight some depressing data from the UK, but I suspect you can transpose this to your own countries as well. The Food Foundation produces an annual report called The Broken Plate, and the facts only get worse. The food system is hugely unjust, and there's a lot of food insecurity even in high-income countries. The poorest fifth of the UK would have to spend 50% of their income to meet just the basic Eat Well guide, which is our government guidelines for healthy nutrition. The poorest tenth of our society in the UK live 20 years less compared to the richest. And if we carry on business as usual, we will be 4 times over the emissions required to meet our target of net zero. So things are really dire. But we're here to discuss some really straightforward, simple solutions that we can undertake ourselves, bring into our community, our practices, and our family lives as well. This is what we want to see of a food system that is fit for purpose, that it's nutritious and healthy, it's sustainable for people and the planet, and of course the producers are farmers, affordable and accessible, culturally adaptable, kind and compassionate. And this is what it should look like. American College of Lifestyle Medicine, a whole food plant-based diet to keep ourselves and the planet healthy. Fruits, vegetables, whole grains, beans, nuts and seeds. Whatever you do around the edges is your personal choice. But what you need to promote good health are these healthy plant foods, mainly water for thirst. There's no requirement for animal foods on the plate. So if we decided to do this ourselves, which I know a lot of us have, bring it into our practice, our communities, we know from decades of data, dozens of studies, that consuming a healthy plant-based diet, like I've shown you, can significantly reduce the risk of our commonest chronic conditions: heart disease, diabetes, cancer, stroke, renal failure. We'll be discussing all of these in the sessions throughout the weekend. A really interesting paper just published a couple of weeks ago showing that a healthy plant-based diet reduces the risk of Parkinson's disease. And we know that people live longer and healthier on a plant-based diet. A word of caution, of course, the right-hand column shows you what happens if you adopt an unhealthy, ultra-processed plant-based diet. It's no better than the standard Western diet, may even be worse. So we're talking about a whole food plant-based diet. So as I say, what you do around the edges is personal choice, but that personal choice is impacting other people, the planet, and the animals. And therefore, it's great to know that the British and other dietetic associations confirm that a healthy plant-based or vegan diet is sufficient for all ages and stages of life. We'll be covering that in detail throughout the conference. Plant-based diets are now integral to any guideline that you'll see in your profession. On the left, American College of Cardiology recommend dietary patterns that can be met by eating a healthy Mediterranean, a DASH-type diet, the healthy vegetarian, and they include exclusively plant-based diets meeting their recommendations. My specialty of cancer: eat a diet rich in fruits, vegetables, whole grains, beans, nuts, and seeds. On the right, very recently published guidelines from Europe on diabetes, prevention and management. Eat a fiber-rich diet centered around plant foods, unsaturated fatty acids. I've copied these statements straight from the guidelines. And country-based guidelines are catching up. We are all in awe of the Canadian guidelines from 2019. 87.5% of calories coming from plant foods is their recommendations. Dairy removed as a food group, and it's perfectly adaptable to a fully plant-based diet. On the left, Danish guidelines: eat plant-rich, varied, not too much. Sounds like the Michael Pollan quote. And in the middle, we'll have a whole section on planetary health, the Eat Lancet Planetary Health Plate. Again, 85% or more of energy should be coming from healthy plant sources. Animal foods are optional, not required, if appropriately planned. And I could have chosen many examples of using food as medicine. Food really is medicine, regardless of the rhetoric on social media. And this is just one paper published a few weeks ago. It was a study of using fruit and vegetable prescriptions in 12 states around the US. And just after 6 months of follow-up, and these were in people who were at risk of cardiometabolic diseases and who were otherwise food insecure, just with these healthcare-led prescriptions, they were able to show significant improvements in consumption of the fruits and vegetables, improvement in food security, health status of both adults and children, and significant improvements in all those cardiometabolic indicators of health we'll be discussing in one of our first sessions, so BMI, blood pressure, and glycated hemoglobin. So we really must be using this information in our clinical practice. We have to be honest where we need more data, and we'll be discussing all of these themes throughout the conference. We've got several speakers talking about bone health. We've got healthy aging, where Alicia will be covering brain health. We've got Brenda Davis, the final speaker of the session, will be talking about healthy aging and how we support older adults on a plant-based diet and avoid frailty. There's always more to learn, and these, for me, are the active areas of research. We will be talking about the microbiome repetitively, I'm sure, but we've got a specific talk from Emily Leeming on the microbiome. We've got Joshua Gibbs talking about plant-based meat alternatives, so much dialogue online in the media about this. And in the middle, I've written precision nutrition. It's a buzzword. It doesn't fill me with that much excitement at the moment, but maybe I'm a dinosaur. But we will be covering, and I'm sure many of you will have questions about personalized precision nutrition as well. Of course, no talk about our diet choices can go by without us covering the climate and biodiversity crisis. And it's really heartening to see that medical journals are now covering this. So on the right, you can see an opinion piece by one of our speakers, Urvi Shah, who'll be speaking in the cancer section, in JAMA Medical Journal, talking about the connection between our dietary choices and the planetary health crisis we face. And there is absolutely no doubt at all that a plant-based diet or a healthy vegan diet is the most impactful action we can take to improve the health of our planet. And we've got a whole section on planetary health later today. On every metric studied, greenhouse gas emission, land and water use, pollution, the vegan diet here from Epic Oxford data came out top. We've got Tammy Tong coming to speak to us about more data from the Epic Oxford cohort. And these data were regardless of how and where the food was produced. So eat plants, it's definitely best for the planet. It's going to be best for helping us with this other crisis of antibiotic-resistant infections, which is now killing 1.3 million people globally every year, more deaths than there are from HIV and malaria combined. And 70% of antibiotics are used in animal farming. And even if we're not prepared to become 100% plant-based, there's a study in Science back in 2019 showed that if all we did was limit meat consumption to 40 grams a day, we would reduce the use of antibiotics in animal farming by 66%, 2/3. So whatever we can do to reduce consumption of animals is beneficial. And we're still emerging from the COVID-19 pandemic, but the next one is just around the corner. It really will be bird flu. And the main drivers of pandemic risk are factory farming and the destruction of animal habitats, mainly due to deforestation to graze animals and grow crops to feed other animals. And every week there's an article in one of the journals demonstrating how bird flu is being found in humans now. It's only a matter of time before this becomes the next tragedy. It is great to see that guidelines are slowly catching up for health professionals, even in the UK. So there's a whole series of papers called Climate and Health on the government website, and I've just chosen some headline messages. They make it clear that the foods that are damaging our own health and the planet's health are exactly the same. There's no conflict here, and that we should all be eating a diet rich in plant-based food, and they acknowledge that some people may limit the consumption of animals, and it is okay if we have a well-planned plant-based diet. So what can we do together today to lead the change? There's numerous things, and I'm sure all of you have got some amazing ideas. We're here because we want to educate ourselves. Once we feel comfortable with the education, we need to support healthcare education wherever we can in our practice, our communities, our hospitals, our families. We need to role model. It's a really effective way of disseminating this information. Use your networks. That's why we're here today. That's why we've made these partnerships to make this information and conference available to you. And use your workplace. My partner in crime at King's College Hospital, LJ Smith, will be talking about our uphill battle of working at King's College Hospital to change the food environment. But workplace is a really effective place to advocate. So in the second part of the talk, I'm just going to take you through some of the work that we do in case you don't know. And I really hope that you'll make use of all of our resources and feedback to us about what you want to see us doing as an organisation. You can learn more about us at our stall. Isabel Sadler, our research assistant, has put together a survey of our members. You can learn more about us. But our mission is to provide education and advocacy on healthy plant-based diets for people and the planet. We do this in a number of ways. Myself, my colleagues, my friends here today have all helped me put together and facilitate and develop the UK's university course on plant-based nutrition, which is now recommended to all GPs in England and Ireland as part of their sustainable healthcare education. We've got incredible resources. Our co-edited textbook with my sister Zara, Lisa Simon, who's also speaking this weekend, is for sale with Hammersmith Books. If you've not got it already, please do flick through and decide to buy it, hopefully. And the main idea is really to keep and get this into medical school and university libraries. So if you've got any influence there, please do recommend this to your library. We run regular webinars. This will be the 4th year of running webinars. Rahini Bajekal runs these. They're free online. The live versions, the recorded versions are for our members. We all provide regular nutrition updates, regular articles. I write a monthly blog. So much to keep up to date with, but we help you do that. Hayley Tate will be part of the community and education section tomorrow. She's providing whole food plant-based cooking knowledge and skills with her Cooking for the Climate in 3 medical schools in the UK at the moment. It would be great to roll this out further. We do dozens of presentations. I guess one of the benefits of the pandemic has been that it's opened up online and virtual presentations. You can reach so many organisations. We do dozens of grand round presentations. We've linked up with the Civil Service Vegan Network, who can invite their colleagues. We're speaking at BDA conferences. We teach in medical schools as part of their lecture series. And we don't shy away from talking about the appalling conditions of animals. We try and publish. It hasn't been a major focus, but we have got lots of publications in recent years. Some of our case studies you'll be meeting in person. Kate Dunbar will be in the exercise and sports section talking about her remarkable recovery from psoriatic arthritis. Karen Lee, without which this conference would not have happened, will be talking about her MS journey. And we've got Isabel Sadler writing up our members survey, and we have our research dietitian joined in January this year, Michael Matudi, who's also going to be doing some research with us. We've got dozens of fact sheets. If you don't use them, please have a look and you'll find one, I'm sure, that will benefit you or your patients. They're free to download from our website. Using your networks, I think this has been one of our most successful collaborations. Angeline Taylor will be talking tomorrow on in the healthy aging section on chronic kidney disease and plant-based diets, so an area that's really come leaps and bounds with the science. And we've put that into information that we can jointly use with the BDA Renal Specialist Committee and us as plant-based health professionals. 3 fact sheets that support plant-based diets for chronic kidney disease, people on dialysis and people with kidney transplants. We support community kitchens. We've got Sarah Bentley here from Made in Hackney, a groundbreaking organisation that's been present in our lives for the last decade. We'll be speaking tomorrow. And we support, as an organisation, Vinnie's Kitchen, a plant-based cook school that Hayley runs on a weekly basis, brings in vulnerable groups to do cooking, and then disseminates hundreds of meals a week to the homeless and to the YMCA and other vulnerable groups. All whole food plant-based, of course. One of our newest ways of disseminating education is our podcast. You'll meet Daisy and Claire, our 2 GPs running that. Please download, subscribe, share, speak to them today, tell them what you want to listen to. This is a podcast for you as practitioners to help you embed plant-based nutrition into your practice and persuade your colleagues to do the same. So in a nutshell, plant-based diets are just one part of the broad specialty of lifestyle medicine. We've got a whole session on lifestyle medicine tomorrow. Laura Freeman is co-founder with me of Plant-Based Health Online, an online lifestyle medicine service here in the UK. We'll be highlighting other lifestyle medicine initiatives in the UK, and we'll also be welcoming the president of the World Lifestyle Medicine Organization tomorrow, Ifeoma. And Claire Lynch, our education lead, has revamped our 21-day challenge. It's completely free. Sign up. You get daily emails for 21 days. It's a great resource for your patients. All evidence-based videos, fact sheets, small bits of easy ways to make changes to your diet. We've all, as a group, written dozens of books. Many of them are on sale today, so please go and have a look and hopefully support our work. We're really proud of our collaborations, and we've got some of our collaborating organisations here today. Greener Practice and Health for XR, we teamed up with them at the Planetary Health Hub for the big one in April. We work with the UK Health Alliance on climate change, supporting them with some policy work, really mainly around their food policy, and you can see that they are telling their member organisations that represent over 1 million healthcare professionals in the UK to prioritise plant-based and sustainably sourced food. And very recently, they signed the Plant-Based Treaty, and the Plant-Based Treaty team are here today as well. So I think this is a major step forward for all of us in our advocacy work. As I say, we are in clinical guidelines. Do have a look at the recently published Irish College of GPs Sustainable Healthcare Guidelines. It links to all our resources, which is amazing. And the Greener Practice and Royal College of GPs Health Toolkit for Sustainability has been recommending our resources for quite a while, and we help update these annually. As I say, workplace is a great place to start, I think. Just putting feelers out to see how receptive people are. There's a lot you can do, and please speak to LJ about the work she's been doing, and you can attend her session on public sector catering. We support a lot of campaigns, and many of them are here today. So we've got the Plant-Based Universities team who have really had amazing success in the last week in the newspapers and on, my mum tells me, on Lorraine on the GMTV, so all is good. Plant-Based Councils are here today as well. Plant-Based Treaty have a stall, and one of the most impactful campaigns we've done this year, which has got me running, is Running on Plants, and Kate Dunbar is an ambassador who 5 years after a diagnosis for psoriatic arthritis has been running marathons this year. So really a truly inspirational campaign. So I think this is where we are, and it's heartening to see that in the medical journals we are getting opinion and editorial pieces that are titled, "Are We What We Eat? The Moral Imperative of the Medical Profession to Promote Plant-Based Nutrition." And this is the conclusion because it covers One Health, including the animals. The medical profession can help to move the needle by embracing a radical change when possible, especially within our own ranks, and incremental change when necessary to promote harm reduction. We owe it to the profession, to our patients, and to the planet we share. So thank you very much, and I'm delighted to hand over to Wendy, who's going to be talking about the magnificent work of PAN and the work that we are hopefully collaborating with going forward. So welcome, Wendy.
Wow. Aren't you all amazed like I am of all the work that is happening here in the UK? Thank you, Shireen. You're really such an inspiring person, and great to see all the work that has been done already here. I'm representing the Physicians Association for Nutrition today. I'm a registered dietitian and a researcher in the Netherlands, and I co-founded PEN in the Netherlands, and I'm on the board there, and I'm on the board of PEN USA. And PEN is now currently present in 11 countries. I should say actually 12, because we're so close with Plant-Based Health Professionals UK. And I just want to go through some issues with you today, because it is, of course, VegMed. And like Shireen already said, it's also about these other reasons besides human and planetary health to become more or less vegan. So first, I want to talk to you about suffering. Because one of the reasons to eat less animals is, of course, suffering. And if you look into that, then I think it's very obvious that if you want to decrease suffering in the world, that the first step you should take, because animals are sentient beings, is to reduce your animal food intake. I think it's really important to underline that. I forgot the name of the ethics professor. What's his name again? The bioethics professor at Princeton University. Peter Singer, yeah, I was thinking about his name. Peter Singer is, of course, the philosopher of our time who is making us aware of this. Because if you want to reduce suffering, then you have to acknowledge that these sentient beings are suffering. However, what's also very important is to realize that we are not seeing that. And one of the people who really showed us that we are actually very blind for that is Melanie Joy. And this is not Melanie Joy, of course. It's a pig. But one of the great questions that Melanie put forward was the question, have you ever wondered why we eat pig's meat and not, for example, golden retriever's meat? Why we drink cow's milk and not pig's milk? And the most important question, have you ever wondered why you never wondered? And this is what she called carnism. And carnism is this invisible belief system that conditions us to eat certain animals. And of course, it is the great Sir Paul McCartney who rephrased that very simply and said, if slaughterhouses would have glass walls, everyone would be a vegetarian. And, but it's not all ethics and psychology. It's also human rights. And if we look into human rights, of course, we think about, for example, the fact that 74 of the lowest income countries are responsible for less than 10% of greenhouse gas emissions. And they are suffering the most. In addition, eating animal products is also very inefficient and contributing to hunger. For example, if we look at the feed crop, then less than 10% of calories, less than 10% of the protein, in the end, ends up in animal-based products like milk and eggs, for example. So, but that's all indirect. More direct is the effect, and this is really a human rights issue, the effect it has on slaughterhouse workers. A systematic review showed that people who work in slaughterhouses suffer greatly from anxiety, from trauma, and from depression. Especially the people who work on the kill floors, they suffer greatly from anxiety. And of course, there are 1 million people in Europe alone working in slaughterhouses. They're mostly immigrant workers working in very, very bad conditions. And of course, they are in no way compensated for their suffering and their work. So I really wanted to underline that there are so many reasons to eat less animals or to refrain from animal consumption altogether. And that every step towards eating less animal products is really a step towards a better world. And of course, what we are talking about today is mostly focused on human and planetary health. And I think Shireen already touched upon it, that so much of what we eat has an impact on climate, and there we can really do something. And as far as health concerned, well, I'm so very glad that we are together here with all you, and I'm convinced that all of you will take all that you've learned today into your workplace for the first, and secondly, also to your patients. And well, if I recently had to give a talk, and it had to be very, very short, and if you have to tell very, very short what plant-based nutrition has an impact on in terms of health, well, then you end up with talking about death. And as you can see here on this slide, that the risk for mortality for replacing 3% of animal-based protein with plant-based protein is huge. As you can see, it favors in all the most important and mostly consumed animal products that it favors plant-based food. Shireen already showed a slide on the British opinion of the Nutrition and Dietetics Association here on vegan and vegetarian diets. It's everywhere. Everyone who has dived into it can say that it is actually suitable for everyone in every phase of their lives. And of course, for some people, you have to take a look further and see whether they get enough protein or they get their supplements. But in the end, it's very, very feasible. And like Shireen showed, fortunately, we are getting there step by step in all the dietary guidelines. So then about the Physicians Association for Nutrition. This is an international nonprofit with the aim to eliminate diet-related diseases and deaths globally. We are from health professionals for health professionals. If you are a health professional, whether you are a doctor, a dietitian, a nurse, any researcher, any health professional, you can join PAN. You can join PAN International. You can join a national office, so you just have to look on paninternational.org to see whether there is a national office in your country, and if not, just contact us. You can establish one, because we need many more. And it's all about also, actually, just as Plant-Based UK, it's all about plant-centered diet for the planet and for human health. So the benefits of becoming a member of PAN, actually, I also put the Dutch website here, pannl.org and paninternational.org for everyone else. And I can't help myself. I want to see the Dutchies over here. We are with so many here. Let me hear you. Let me hear you. Yeah, it's awesome. We were all trapped in train traffic yesterday, but we came here almost all by train, and we have a very vivid community in the Netherlands and in many other countries. For example, I was just looking up South Africa, where we have a great community, and they are actually involved with the African Summit for climate change. So very proud of them as well. And for example, in Israel, they are hugely active. We try to involve and work with students where we can, and we try to keep the entrance level very low, so we are not costly, and you can join workshops, congresses. We have journal clubs in many countries, so it has a lot of benefits to become a member. And of course, if you're in the UK, you just go to Plant-Based Health UK. We also make sure that we supply, for example, health professionals with documents and materials that they can share with their patients. And of course, for everyone, because we are followed also by a lot of people who are not health professionals, but interested lay people. And I'll keep it short because my time is up. I'm very glad you're here. I want to thank Plant-Based Health UK. I want to thank also ProVeg. It's great to be here. I'm looking forward to see you all. I will have a talk on rheumatic diseases later on with Carlijn Wagenaar. And I think it's important that we stick together, that we talk with each other, that we talk with a lot of people, and that we can find each other whenever we need more info. For example, that you know the colleague, the dietitian who knows everything about cancer, that you know that one GP who is able to plant these small seeds, like, for example, Gemma Newman, that you can follow her. It's you, Gemma. And there are so many wonderful, for example, the president here of PAN, the Netherlands, a how do you call it in English? Gastroenterologist, a pneumologist from the Netherlands, and many other specialists that you can just walk up to and ask, hey, how am I going to help my patient? Or how am I going to introduce nutrition in my workspace? So join whatever you do, whatever, from whatever you, I want to mention Caring Doctors. Show it, wave Caring Doctors. Patrick, he is an awesome activist. I would call him an activist, actually. He started Caring Doctors and is really pushing hospitals to go plant-based. So let's meet each other, let's listen to each other, let's talk to each other, and let's spread this word, join our mission, let's change the way the world eats. Thank you.